There's little doubt that kids today weigh much more than they did in years past, and many have serious weight-related health problems. Nationwide, more than 1 million teens are considered obese. That's 1 out of every 6 teenagers.
Obesity in children is rising at an alarming rate. Some people have called it an epidemic. I think that's probably accurate.
About 750,000 adolescents across the country who have a body mass index of greater than 40, which equates to an adolescent who is over 100 pounds overweight.
Most overweight teenagers can lose weight through self-controlled diet and exercise. But once a youth is more than 100 pounds overweight, he or she is considered morbidly obese and faces great difficulty losing weight without medical intervention. This excess weight can lead to a host of other medical problems.
Diseases that we used to see in older adults, we're now seeing in kids. High blood pressure, liver disease, it just goes on and on. It's really dramatic.
We've been treating obesity here at DuPont Hospital for Children for the last 20 years, and over that period of time we've seen the problem get more severe, and that some of the kids were more severely affected with their obesity and weren't responding to what we typically do. The hallmark of obesity treatment is lifestyle modifications, such as working on eating healthier and exercising and a positive attitude. And while that's very important, the impact of that in a child who weighs 150 pounds was not enough to cure their weight or their problems from their weight.
For these obese teens, diet and exercise alone won't work, but a medical procedure is now available that may help them lose the weight that threatens to shorten their lives. It's called adolescent gastric banding surgery, a minimally invasive procedure that severely reduces the amount of food that can enter the stomach without the need to actually cut the stomach to reduce its size.
It's really a very simple concept. You can, in order to get people to lose weight, you can either bypass a lot of their intestines so that the nutrients aren't absorbed, or you can create a smaller stomach so that they get full faster. And that's really what the lap band does.
It is surgery, so any surgery for this problem is a bit of a dramatic or drastic intervention. But so I think you always have to match the intervention to the disease. And if you're looking at an adolescent who weighs 150 pounds overweight and who has significant medical problems like sleep apnea, joint problems, diabetes, from that weight, I think you have to match the treatment to the disease.
In the gastric banding procedure, a silicone band is inserted around the top of the stomach to create a small stomach pouch about the size of an egg. The radically smaller stomach limits patients to only about 4 ounces of food at a time, causing them to feel full after a few bites.
Where they have to get used to dramatically having less portion sizes, being not able to eat the quantities that they may have been used to, or the types of foods they're used to, and that's an also dramatic change for them.
I mean, the pouch is only the size of an egg. It's a 4-ounce pouch. You have to really work hard to get enough fluid in during the day, enough protein in during the day, and yet still be able to live a normal life. So it's a huge change for these kids. And some of the kids, you know, they weed themselves out early on in the process. If they can't make those changes, I definitely don't want to be operating on them.
The Nemours Alfred I. DuPont Hospital for Children is one of 4 hospitals nationwide offering this procedure for adolescents as part of a Food and Drug Administration research study on the effectiveness of gastric banding surgery in teens. It's a 5-year experiment in which families of teenagers like Carol Kane spent months preparing for this radical but highly effective procedure for limiting food intake. Carol had to not only learn about nutrition and a drastically different lifestyle, but also learn about proper exercise and dealing with issues like stress and depression that can trigger overeating.
We teach adequate protein intake. I teach the kids how to count out 60 grams of protein a day, making sure they're getting adequate fluids, 48 to 64 ounces of fluid a day. They cannot eat and drink at the same time. We talk about structuring your meals, taking your vitamins, no gum chewing, and no straws, no caffeinated, carbonated, or sweetened beverages as well. And the funny thing about that is, the kids are happy to do that. They're feeling better, they're losing weight, they are looking forward to their next healthy meal.
I've lost 53 pounds and I lose about like 3 pounds a week. Before, like when we started all this, you get a little notebook and they ask you like, what would you do if you lost weight? And I said run. And I want to run without getting out of breath, and you know, getting closer to that.
Once she had the surgery, in the first 3 months after surgery, she's continued to do all the things that she's done preoperatively, and now she has the band, which is helping her limit her portion sizes and not be hungry all the time. And through that, she's lost an additional 55 pounds in the first 3 months after surgery. So I think if you look at the whole picture, it is a tremendous outcome, which probably would not have been possible without the FDA study and without the band.
This is a program that has been treating obese children for years, probably one of the oldest of its kind in the country. We've put together a group of specialists with different interests that really wrap themselves nicely around the patient and the family, and I think provide a unique treatment opportunity. And I think the FDA is excited to see how programs like this will handle the surgical approach to obesity.
After 2 years of study, results of the gastric band procedure have shown that the typical morbidly obese teen can lose up to 50% excess weight within a year. But the hard part begins after surgery, when a major change in lifestyle is needed.
Any treatment of obesity has to have lifestyle in it. So surely to be successful with any obesity treatment, you have to make pretty dramatic lifestyle changes. So we ask the kids preoperatively to make these lifestyle changes that are ultimately very important, i.e. eat healthier, eat your meals, make healthy food choices, get your physical activity in, be aware of the importance of this, have a supportive family to do that.
And I think the most important part really is the program that we wrap around these kids. This isn't something that they come in the hospital and they get a band and they go home and we forget about them. I think just as important, or probably more important than the technique that we use, is the time we spend in preparing them, the time we spend in screening the right people, the people who are going to be able to make the changes they need to make, and then seeing them again post-operatively on a repeated basis to deal with things that come up.
I'm definitely glad I did it, and it is hard. I mean, you have to go in this for the right reasons.
I think when you combine lifestyle and combine the band, you can expect weight loss that you would not achieve in traditional behavioral weight management. And that's the light at the end of the tunnel for these kids.
It's a procedure that now gives overweight children a fighting chance against obesity, and a call for change in individual lifestyle that will allow children and families to lead healthier lives. For more than 65 years, the Nemours Alfred I. DuPont Hospital for Children has put the children first in all aspects of its operation, serving thousands of children from across the nation and around the world on its 300-acre estate outside Wilmington, Delaware. DuPont Hospital is a center of renowned specialists who treat the child, not just the condition.
We're really here to try to alleviate suffering and provide wellness and health for children.
To see the kids come in and do well, there's nothing, obviously as a physician, there's nothing better that can make your day to see someone's disease get better.
With physicians and surgeons in nearly every pediatric subspecialty, the DuPont Hospital has grown far beyond its original mission to help children with orthopedic disabilities. The 200-bed hospital now offers all the specialties of pediatric medicine, surgery, and dentistry in a family-focused environment, from neurosurgery to alternative methods for treatment of childhood obesity.
An important area for us is weight management. Another important area is cardiac disease. And in all those areas, we try not only to take very good care of the kids and their families, but really be on the cutting edge of research and teaching.
As an institution, there's been a lot of commitment to doing this right, and a lot of skilled people here in helping kids deal with a very difficult problem.
The DuPont Hospital for Children has remained faithful to the DuPont family's original mission of treating sick and disabled children, but doing so today in a different era of cutting-edge technology. For more information, visit nemours.org.